The following is for informational and educational purposes only. Please consult your physician for personalized medical advice. What is urinary urgency, and how does it lead to urinary frequency? A full bladder should hold approximately 2 cups or 500 milliliters of liquid. Urinary urgency occurs when the bladder creates a strong and urgent sensation to void or empty. In normal circumstances, bladder signals should only be strong when the bladder is near full. Urinary urgency becomes a problem when bladder signals are so strong that you have to stop what you are doing and rush to the bathroom, even if the bladder is not full. If you are unable to hold the urine when this happens, that is called urge urinary incontinence. Sometimes, urgency occurs because the bladder has been unknowingly trained to think it needs to empty before it is full. If we experience urinary urgency when the bladder is not full, this often leads to another condition called urinary frequency. Urinary urgency and frequency quite often occur together. The micturition reflex and urinary urgency. In reality, the bladder is never truly empty. Even after a trip to the bathroom, there is normally a small residual volume of urine in the bladder, called the post-void residual. It is always filling little by little. The bladder and brain work together to control urination through a reflex called the micturition reflex. The bladder will first signal to the brain that its volume is filling well before it is full. In normal circumstances, this communication from the bladder to the brain should seem like a gentle nudge or whisper. With urinary urgency, this communication is louder and dramatic when it does not necessarily need to be, because the bladder may not yet be full. By voluntarily emptying the bladder before it is full, or close to it, the bladder will begin to send signals of fullness to the brain earlier and earlier, resulting in shorter times before the urges to void become stronger, regardless of fullness. This results in shorter times that you can tolerate between voids. If a person is voiding more frequently than every 2 hours, that is called urinary frequency. A normal voiding schedule is considered to be approximately 2 to 4 hours. Interrupting the micturition reflex to control urgency. When a person is ready to void, the bladder muscle squeezes to start the act of urination. The pelvic floor muscles relax to allow the urine to expel. These two muscle groups work in opposition to one another. The bladder muscle is automatic, but the pelvic floor muscles are voluntary and operate under our conscious control. Because the pelvic floor muscles are the gatekeeper to letting urine out, you can voluntarily decide to hold the urine longer until the bladder is more full. However, if urgency is a problem, the sensation of urgency needs to be quieted to interrupt the micturition reflex. Luckily, we can help quiet bladder urges and retrain the bladder to know when it is truly full by using what is called the urge suppression technique. To perform it, it is best to stop what you are doing and sit down if possible. Then, perform 5 to 10 repetitive quick pelvic floor muscle contractions, also known as Kegel exercises. To engage your pelvic floor muscles, imagine you are lifting a marble with your anus and lifting an elevator in your vagina. Close the elevator doors and lift the elevator up. Both the front and the back regions of the pelvic floor should gently squeeze and lift from outside in. Performing this motion repetitively will engage something known as the reflex of micturition inhibition, where the bladder relaxes because the pelvic floor is contracting. After performing 5 to 10 pelvic floor muscle contractions, it is very important to distract yourself, as distraction is helpful in deterring the urgency from returning. With practice and consistent use of this technique during improperly timed urges, the neural connections of the brain having to do with bladder timing will begin to adjust to allow more time between bathroom trips to void.